Hey guys, so today's video is going to be about toe walking in kids. Hi everyone, it's me, Dr. Nooreen, your resident foot and ankle specialist, and welcome back to my channel. So you guys, toe walking is a pattern of walking in which a child walks on the balls of their feet so that their heel never touches the ground. Toe walking usually starts in children when they learn how to walk, or sometimes it can also start a few months after they've already learned how to walk. Until about the age 2 or 3, toe walking can be normal in children and usually resolves on its own. However, after 2 to 3 years old, if the child is still toe walking, it could be an indication of underlying pathology. But keep in mind, even after 2 to 3 years old, some kids will still toe walk simply out of habit. So what are some causes of toe walking after 2 to 3 years old? Most commonly, it's due to something I talk to you guys about all the time, a short gastrocnemius muscle belly or a tight Achilles tendon. But it could also be due to some underlying neurological causes like cerebral palsy, muscular dystrophy, and autism. So you guys, if you're a parent or guardian of someone who is under 2 to 3 years old and is toe walking, don't panic, it will most likely resolve on its own. If you have a 2 to 3 year old that is toe walking and also has neurological deficits such as muscle weakness, loss of balance, decrease in reflexes, abnormal reflexes, decrease in sensation, just to name a few, take them to their physician. Because toe walking in combination with those symptoms that I just mentioned could be an indication that something else is going on. Now, if you are a parent or guardian of someone who's 2 to 3 years old and is toe walking and you're worried about it, still take them to their physician, because if you're worried about it and it makes you feel better just to get it checked out, go ahead and do that. But just keep in mind, most of this, most likely, most often, the toe walking resolves on its own. Now, if your child is a toe walker, most likely it's idiopathic, meaning the reason why they're doing it is unknown. And the physical exam and the neurological exams are normal. Now, with that being said, one of the most common reasons for kids being a toe walker is, like I mentioned a little bit earlier, a tight gastrocnemius muscle belly or short Achilles tendon. And in that scenario, the treatment is stretching. Now, you can accomplish stretching by physically having your child perform stretches. Your child can be put into braces to help them stretch. They can also be put into casts to help them stretch. Now, sometimes orthotics can also help because it'll make the ground feel more comfortable for your child, so they're going to be more willing to try to put that heel on the ground. And you guys, of course, physical therapy can always help you stretch out your muscles, so that's also an option. Now, in some rare cases, you might have to go and surgically lengthen the Achilles tendon, but that is super rare for toe walkers. Okay, and like I mentioned, in super rare cases, this is not the norm. Toe walking can be due to an underlying neurological deficit, such as cerebral palsy, muscular dystrophy, or autism. And in those situations, the underlying neurological deficit needs to be identified and managed. Okay guys, so in summary, toe walking is totally normal and will likely resolve on its own. However, if your child is toe walking and is also presenting with neurological deficits, take them to the physician to get it checked out. If your child is toe walking and you're worried about it, just to make yourself feel better, take them to a physician to get it checked out, because they can do a physical exam and a neurological exam and make sure that everything is okay. But if you're a parent out there watching this video, don't panic. Likely this will resolve on its own. Okay guys, that's my video about toe walking. If you have any questions or concerns, please leave them in the comments section down below and I will for sure address them. And you guys, as always, don't forget to stretch and subscribe. Like this video. Thank you for watching. I'll see you guys next week. Bye.